Thanks for listening to the Lunch and Learn with Dr. Barry, here to help educate, motivate, and put you on the right path to take control of your health through weekly discussions on topics in the medical field, public health arena, and in your community. And now your host, Dr. Barry.
Hey everybody, this is Dr. Barry. You are listening to episode 35. And if you want my show notes, as always, we're going to go to drpierresblog.com/LLP035. Again, if you want today's show notes, please go to drpierresblog.com/LLP035. And on today's episode, I actually have a special gift for you guys. So if you want a great infographic on what we're going to be talking about on today's episode, which is sickle cell disease and the pain of sickle cell disease, please text the word sickle cell, which is SICKLE CELL to 44222. Again, you're going to text the word sickle cell to SICKLE CELL to 44222. So you're going to text those two words to that number, and I'm going to send you my graphic on sickle cell disease. You're going to get some fun facts and figures and be able to kind of follow along with what's going on today's episode. So let's take some time and learn about sickle cell disease today. So as we get the month of September started, I think it's only right that we start out with sickle cell awareness, because again, it is Sickle Cell Awareness Month, and it's something that I look forward to every year, only because of the patient population I tend to deal with, being majority African American, especially when I was in my outpatient practice. It was always a question that would come up, maybe 1 out of every 10 patients. They wanted to know, how to treat sickle cell disease, how they diagnose sickle cell disease, what they can do to prevent it. And these are just very common questions that I would get all the time, especially from the population I dealt with. So, when September comes around, I definitely look forward to being able to educate the masses on sickle cell disease. Because again, in the grand scheme of things, it's not a disease that's prevalent as much as what you would think about when we talk about diabetes, when we talk about hypertension, when we talk about high cholesterol, or even obesity. This is a disorder that really affects a population at such a more alarming rate that you almost have to focus on it, right? And, for, those who've been following the podcast, especially when there's a disorder that tends to affect African American, men and women at a lot higher rate than other groups, I am more particularly interested in wanting to talk about it. Why? Because, again, of course, if you can see the podcast artwork, I am African American, right? So, I want to make sure that this is something that could probably affect me. I want to know a little bit more about it. So I'm going to be talking about sickle cell disease today. We're going to be talking about some signs and symptoms of patients who deal with sickle cell disease, give you some common cold hard facts, which is always good to know, some complications associated with sickle cell disease, and some treatment disorder. But I think, especially when we go with the theme of, the title of this episode, the pain of sickle cell disease, I want to kind of touch on that aspect definitely more importantly. So, we'll hit these high points, but we'll definitely focus at the end, the highlight of what it means to, to have sickle cell disease and to deal with the pain, right? And when I say pain, I don't mean just the physical pain that patients with sickle cell disease face on sometimes a daily chronic basis, but even the mental stigma kind of associated with sickle cell disease for patients who are in the hospitals or in the outpatient offices, right? So it's definitely something, that I want to, kind of keep an eye on because of it, because it's definitely something that going from inpatient to outpatient medicine is definitely something that I'm seeing a lot more of in that regards. And then when I went back to inpatient medicine, I had residency. Residency was pretty much all inpatient. My attending, especially when I first came out, was all outpatient pretty much. And now I'm back full swing, almost full circle in inpatient medicine again. So I'm starting to see those same characteristics of things that, I don't like. And, something that I want to make sure that we kind of educate are health professionals as well when dealing with patients with sickle cell disease. And, why not this month, right? Because, again, this Sickle Cell Disease Awareness Month was actually started in 1983, right? So in 1983, they started wanting to highlight what it meant to have sickle cell disease, and they wanted to educate not only the health professionals, but they wanted to educate the masses as well in learning and understanding how to deal with sickle cell disease. Because I can tell you back then, not even if I say back then again, 20, 25 years ago, your life expectancy for patients with sickle cell disease was about 30 years old. So 30 years old was the life expectancy for someone who was diagnosed with sickle cell disease. And, fortunately, time and technology and modern medicine has kind of, sped up and kind of helped with that process. So now the average life expectancy is between 55 to 65 years old, which, again, is definitely much higher than what it used to be 20 years ago, right? So when we think about that. So when we talk about sickle cell disease and we talk about what that even means, we have to know what's the norm, right? Because, again, it's very difficult to talk about disease if you don't know what the actual normal is, right? And when we talk about what a sickle cell is, right, versus what a normal cell, right? And when we talk about cells, we're talking about red blood cells, right? Our red blood cells, their job is to carry oxygen, right, in our blood, from to and fro, from point A to point Z. But what happens, especially with your patients with sickle cell disease, is that cell is a different shape. And because of the different shape of that cell, it's not able to function like your regular normal red blood cell. Your normal regular blood cell may be able to hold, let's say, capacity of, I will break it up into fours, let's say four, so 4/4, right? So your regular blood cell can hold 4/4 worth of oxygen, whereas your sickle cell may only be able to hold 1/4 of your oxygen, right? So we can get nice, clean math numbers, right? So we can kind of start understanding what this means from a problem standpoint. And then what occurs is that because it's only able to hold, 1/4, right? 1/4 of the amount of oxygen that the regular blood cells can hold, you become very weak, you become very tired, and fatigue is a very common symptom associated with sickle cell disease, right? In this country, sickle cell disease is the most common genetic disorder, right? Let's think about that, right? So from in the United States, and for the numbers who are affected, right, the sickle cell disease affects about 90 to 100,000 people, with about 60 to 80, just depending on where you're looking at, 60 to 80% of those being African American. And, those numbers are, startling and, troubling. And when they break it down, they say that 1 out of every 500, right? 1 out of every 500 African Americans has the trait or the disease. And 1 out of 36,000 Hispanic Americans has the trait or disease, right? So again, just to kind of show you just how much of a severity is, right? When it goes from one group to the next, right? Just so, and those things kind of tell 2 points, right? It says that those things tell us 2 points, right? It says that sickle cell disease is not just a disease of African Americans, right? So that's one thing it tells us. But it also says that, most likely if you're reading a textbook, and I can tell you, especially from a medical standpoint, a lot of those questions, when they start, curtailing and pointing to sickle cell disease, most likely they're going to include an African American subject. But because of that, right, the majority of your disorder and your complications are going to only affect that certain population, right? So again, that's going to always, raise my antenna and say, you know what, I need to know a little bit more about this disorder, right? So from the sickle disease, right? The sickle cell disease, right? We talked about this cell that's already abnormal. It goes from being able to carry 4/4 of oxygen to only 1/4 of oxygen. That being said, when that occurs, right, it's carrying less oxygen, so your body has less oxygen to occur, so you're more tired, you're more fatigued. And these cells, unfortunately, don't even last as long, right? So the normal red blood cell lasts about 90 to 120 days in the body. One cell, 90 to 120 days. But your sickle cell patients, their sickle cell, like that blood cell that's sickling, only lasts about 10 to 20 days, right? So up to 3 weeks is all you can get with one cell who's sickle versus a person who's normal. So what that occurs is that what happens is that makes your body have to produce so much more cells to try to keep up with the demand. Because again, we already have one cell that's carrying 25% of what the normal cell is from an oxygen level standpoint. So your body's spitting out red blood cells, spitting out more red blood cells to try to keep up and compensate. But now it has to compensate for the fact that not only is it putting out all of these irregular blood cells, but it's also putting ones that die quicker too. So it's going to keep having to have a replenish until, it can't no more. So that, again, that's where, our patients, especially when we talk about sickle cell anemia, like that's where the anemia actually comes in, right? Because your body just cannot keep up with the demand of having to produce more bad cells. And because it does that, boom, the problems arise. Some of the common complications associated with sickle cell disease, and the most common that you may know of is the pain episode, right, or the sickle crisis. And a lot of these patients either end up in the outpatient doctor's office or in the hospital, right, because the pain is so great and so unbearable that it feels like their gallbladder. It feels like the heart attack. It's just that painful. It feels like the largest kidney stone ever. It's just that painful from a pain standpoint. And you may be wondering, well, why is it so painful? For your patients who have regular blood cells, right? They kind of move to and from the body through the vessels with no resistance whatsoever. But what occurs, especially in your patients with sickle cell disease, is that those abnormal shapes actually make it much more difficult for the oxygen level to kind of go from point A to point B, and that's where the problems arise, and that's where the pain and discomfort comes in. So let's recap just real quick, right, of how bad it is kind of to have sickle cell disease, right? So you have a cell, right, that is already abnormal than your regular blood cell, right? It already carries 25% the amount of oxygen that your regular blood cell does, right? It already dies much, much, much sooner than your average blood cell, right? Again, we're talking about 3 to 4 months to 10 to 20 days, right? So it does all that. And then after it does all that, after it has all those problems, then it causes you to have pain because it can't move anywhere. Because your body's producing so much to try to keep up that it doesn't do anywhere. It's almost, think about it like your plumbing getting clogged, right? So it actually plugs the plumbing down, and though that area where blood flow was supposed to go but doesn't, and a lot of times it's the muscle. That's where the pain and discomfort comes in, and then they end up in the hospital. Infection is very common. Patients who suffer from sickle cell disease are going to be more likely to be affected by infection than a person who does not have sickle cell disease. Patients with sickle cell disease also are more likely to patients with sickle cell disease also are more likely to suffer from stroke. And that, again, if you think about that premise when we talked about the pain crisis, where you have areas of the body where blood flow is not getting to because it's stuck and it just can't get to. Again, you have that same scenario where someone's having a stroke, where you're a 25, 30, 35-year-old person, and now you have a stroke because of the sickle disease, right? So when I talked about how 20 years ago, right, your sickle patients were living past the age of 35, this is some of the reasons why. Like, they were getting much more infections. Their pain episodes were much more frequent, and then they were having strokes, right? So there was a lot of different risk factors, again, all associated with the sickle cell disease, but also a very poignant, underlying theme of why, they die when they die. And some other complications associated include, some early eye disease, some chest syndromes, For my men, priapism. And if you want to think about what priapism is, when you've seen the Geico commercials that say if your erection has lasted longer than 4 hours, seek medical help, that's what priapism is, right? Because again, it has to do with blood flow being able to get to one place but not being able to escape out. And for those who know from a anatomy standpoint, to get an erection, you got to get increased blood flow. So you may be able to get increased blood flow, but the problem is that now that blood flow that needs to decrease and go away, it can't because those cells are stuck. So that's something again to think about when we talk about a regular complication from sickle cell disease. Quite often than not, your sickle patients will have no spleen. And the reason why they won't have no spleen is because the spleen's job, for a lot of people don't do, it's actually a big defense mechanism. And the spleen's job is to, break down and, let's say eat. We'll just say eat, right? Break down and eat all of those bad cells that aren't supposed to be there. Or, there's something defective by it, right? When you think about the spleen, think of it like almost like a secondary press that kind of like looks over to make sure the first one did everything right. The problem with that, right, in your sickle patients, every single one of your cells is abnormal. So every single one of your cells is abnormal, and your spleen is spending all of this time as a child trying to clean it up, and it gets to a point where it can't, where it gets so enlarged, so big, because the backup in the spleen is that you have all of these cells that are abnormal, and the spleen is trying to catch all of them and hold all of them, that it eventually causes the spleen to extremely get bigger, but then just shrink from death, right? So it actually shrinks from death because there's no blood supply, no blood flow kind of going to it. So definitely a complication to think about, and especially for the kids who have sickle cell disease, because again, it is a chronic genetic disease that you get from both your parents. So the kids who have genetic disease or sickle cell disease, by the time they get older, it is not out of the ordinary for them just not to have the spleen, or have an extremely small spleen, which pretty much essentially is nothing in that regards. When we talk about, going to segue into the treatment plan, there's a few treatment plans associated with sickle cell disease. A part of it is, the management of the big complications, right? Including, the pain episodes, the infections, the strokes. So, the majority of your treatment plan is just making sure that you are addressing those issues. Number one, you're making sure that your patients are actually going to get their vaccinations, right? Because as a sickle patient, I already told you that you're more likely to have an infection than a person who does have sickle cell disease. So, to add, salt to the wound, then you don't get your normal immunizations, and then you end up getting sick off of the flu, right? End up getting sick off of pneumonia, something that we try to prevent. Again, not to say that we can prevent it if you take vaccines, but it usually makes the severity a little bit shorter than not, right? There's medications, in particular hydroxyurea is the most popular one for patients with sickle cell disease, and its job again is to really try to make it so that you don't go into as many pain crisis than you need to, right? So that's where that comes and plays its biggest role in that regards. And also, again, just being very, very well hydrated, because your sickle patients always go into this acute pain syndrome whenever they're not getting fluid. And I can tell you from a hospital standpoint, one of the primary things we have to do, especially for any patient who is suffering from sickle cell disease, is make sure they have pain control, and make sure they're drinking plenty of fluid, because that's where the bread and butter comes in at. That's where the treatment plans comes in at. That's where you can avoid your patients going to see you in the hospital, right? Because you're doing everything you can to want to try to prevent these preventable issues, including And on one hand, you work on trying to prevent a lot of these acute pain crises that occur. And, sometimes, they still get a pain crisis, right? Because, again, you could be doing everything. You could be drinking gallons of water, taking your medications. You could still possibly get a infection, and you could still, have a crisis, right? So, again, that doesn't necessarily negate everything that you've done, but it's just a point to understand that because of all of the complications that we know are associated with sickle cell disease, that we always strongly recommend taking care of these businesses first before kind of moving on. So I want to, and again, that's kind of like the end of a nice little overview of sickle cell disease. But I really wanted to kind of tap into, the aspect of the pain of your sickle patient, right? And the reason why I say that is that, I'm a hospital medicine physician now, and, I'm seeing patients pretty much in the hospital setting. And, every now and then we do get a sickle cell patient who comes in who's in crisis. And I think for, unless your head has been in the sand, you understand that a lot of the epidemic that we're dealing with, especially from a drug standpoint, is, physician related, right? A lot of it, happens to deal with physicians, dealing with pain in a certain way and, making sure that they get high marks on the survey so the insurance companies don't, dock them for pay or something. And the goal, right, the goal of those surveys was always to try to make sure, you did better. And what's happened is that because you had to do better, you had to treat the pain, right? You had to treat all of this pain. And what I've noticed is that for patients who are chronic pain patients, they tend to seem to get a little bit more leeway than your sickle patients, right? And remember, I talked about your sickle cell patients usually being on the young side because, again, it is a chronic disease. Both your parents usually have to have the trait for you to get it. So because of that aspect of it, right, we're getting a lot of patients who, are in pain, but you may not physically be able to see the pain, right? And I think this is what's something that was brought up when we talk about this, the opioid epidemic, right? Again, even though we're not talking about the opioid epidemic on this episode, maybe we should, and I think we'll probably leave that to another episode. So we're talking about, the sickle cell disease, and we're talking about this pain, and what tends to happen is from a healthcare standpoint, we try to objectify what pain really means. And for patients who, who are sickle and they've been in a hospital and the doctor's always telling them what their hemoglobin is, the doctor's always telling them what their reticulocyte count is, because those are markers that we can follow, and particularly to see, hey, are you having a crisis? And, do you need immediate intervention? So that's something that, to from a background standpoint to kind of understand, show you why, right, we deal with their pain. But what happens, right, unfortunately for your sickle patients, is that their pain tends to get downplayed. So their pain tends to get downplayed, one, because they may not necessarily look in pain. And the reason why I say that is because your sickle patients have such a high tolerance for pain and pain medication and pain control that the normal standard, pain medications used to giving may not be enough. And for a lot of physicians, their, radar goes up when that occurs, right? So even if they know the patient has, sickle cell disease, right, for some reason, right, at the corner of their eye, they wonder, is this person faking, right? Now, I'm going to tell you this right now, right? I was a medical resident, I think it was either my second or third year, when I had a patient, and this was probably the saddest case in this person's life, right? Who actually lied about having sickle cell disease. And the reason why she lied is because, again, for your patients who have sickle cell disease, they have crisis, a lot of times they require opioid medications from a treatment standpoint. So, she wanted, someone to say that she had sickle cell disease and she wanted to be treated like it. But what tends to occur is, and I talked about, those markers, right? For one of the patients, one of the residents got so upset, right, with the patient because she had become very demanding, and this may have been like her third or fourth or fifth or sixth, visit to our ER, they finally said, I'm going to check to actually see if you actually have it. So they ran this genetic screening on her, which takes forever to come back. And it was found that she did not actually have sickle cell disease. She had the trait. Now, for those who had the trait, I will point out that yes, you can experience some muscle cramps and pain at times, but it's nowhere near the amount of pain and discomfort that you're getting if you actually have the disease, right? So just to make sure, for my patients and listeners who may have sickle cell trait, and almost feel shunned because they feel like, hey, if I have trait, I shouldn't have pain. It's not uncommon for you to have pain. Again, it's not uncommon for you to have any vague complaints whatsoever in that regard, right? So that's where that comes in at, in terms of the treatment aspect. Now, when we go from trying to treat the pain versus treat the patient, I think and again, I can only speak from the physician standpoint, right, is that when we're dealing with our patients, with sickle cell disease, we have to be very mindful that they're not going to experience pain the way we experience pain. These are kids and adults who've been dealing with chronic pain all their life. Since the second they were born, they were dealing with sickle cell disease, right? So they've been dealing with pain all their life. So yes, you may be used to giving a certain pain regimen, but as the physician, we have to be able to understand that, I understand this, but this isn't regular pain. This is a pain that, I may not be able to see on the blood test, yay or nay, whether she's in pain, but your best bet in scenario is that they are, right? And again, when we talk about, your sickle patients, the best bet is to think about all of your patients with sickle cell disease. If you don't get them their immunizations, or if you don't keep them healthy, they will go into crisis, right? And those crises can sometimes last 2 to 4 to 5 days, right? Just dealing with an acute crisis of pain in a person with sickle cell disease. So it's definitely something that is very telling, and it's definitely something that I always feel that we should be very mindful of, because it does happen way more often than not. And what I've been finding, having to teach my medical residents, is that yes, they have pain. Yes, they may look comfortable, but we have to understand that they tend to know a little bit more about pain than we do. So you do not have to hold the trigger and be concerned and cautious because they tend to be asking for more pain. So that's something I definitely want to make sure we reach out to our medical students and even residents who are following and understanding that in your sickle patients, you're allowed to have pain, and you're allowed to be as comfortable as you want while you're having as much pain as you want, right? Like you don't have to pick and choose and be miserable while also feeling miserable. Like you can be miserable and say, you know what, I'm going to deal with this pain today, or you know what, I'm going to go to the hospital, right? Because neither choice is a bad choice. But I would understand, especially if you're a sickle patient, right, or you grew up with sickle patients, and you understand that the stigma that comes behind having sickle cell disease automatically jumps you to drug seeker, drug seeker, drug seeker. And that's something I want to make sure, the residents of my program understand and know that for a lot of times, they're just not actively having their pain controlled. And they're okay and understand that they're going to have pain and it's probably not going to go away. But when it's out of the ordinary, I think, we as physicians have to do a better job at recognizing it. And we have to do a better job at, getting to that point of attack where, the person or the patient feels comfortable telling you, this is what's going on. What do you want to do? So again, that wraps up, episode 35 of the Lunch and Learn. For those who want the show notes, again, go to drpierresblog.com/LLP035. If you want a nice, cool graphic on sickle cell disease, please text sickle cell, all one word, to 44222. Again, if you want, a nice little infographic on some facts and figures with sickle cell disease, please text sickle cell, all in one word, to 44222. Again, sickle cell is SICKLECELL. So you guys have a great evening, morning, day, whenever you happen to be listening to this. And I will see you guys next week. Thank you for listening to another episode of the Lunch and Learn with Dr. Barry. I want to say thanks again for all that you guys do and all of your support and all of your listens. So I want you to kind of keep on keeping on with going ahead and sharing today's episode. Go ahead and subscribe to the podcast if you're not already subscribed to the podcast. Follow me on Instagram, Twitter, and Facebook, all at the same name, Lunch Learn Pod. And go to the website again, lunchlearnpod.com, for all of the episodes if you've missed one. And again, I'm at all of the favorite podcast apps: Google Play, Stitcher, SoundCloud, and of course Apple Podcasts, where I would love a 5-star review. And tell me what you think about today's episode. I would love to hear it. So I'll see you guys next week. Bye.